Hello, and welcome to the online offering for verbal communication for charge nurses. My name is Mike Finch, and I'm going to be narrating this period of instruction. As you can imagine, good communication is essential for charge nurses to be successful. And as a charge nurse, you're going to need to communicate with staff, nurses, assistants, administrative personnel, residents, students, other nursing units, and other departments, pretty much the entire facility during the course of your job. So the objectives for this course are as follows. We're going to discuss ways to create an open communication climate. We're going to recognize effective speaking practices, recognize effective listening practices. We're going to talk about the three parts of communication. We're going to make sure we differentiate between different generational groups. In every communication process, you will always have these three parts. There will always be a sender, there will always be the information, and there will always be a receiver. So the first part of the communication process is the sender. This is who has the information that starts as a thought. So the sender, which could be you, puts those thoughts into words, whether spoken or written, to pass on the information to someone else. So this could be you getting ready to give report. You have all the information, so you're getting ready to put it together to give it to somebody else. The information. This is the actual data that the sender is going to give to the receiver. It can be either fact or opinion. So this would be what you're going to give to another nurse in an SBAR format. That actual patient information, their blood pressure, their history, what's going on, why they're coming to the OR, why they're being transferred to the ICU, that type of thing. Please remember with that, this information is fact or opinion. A fact would be something like their vitals. A fact would be something like what surgical procedure they had. An opinion would be something like, well, I don't think this guy's very nice. The reason I bring this up is you want to be very careful in your communication to use facts as much as possible and not opinions, because opinions can bias what the receiver sees as the message. The third and final part of communication is the receiver. This is the person who's getting that information from the sender and translates it to his or her own thoughts. So the success of the sender at this point depends on how accurately they receive and translate that information. So if you're thinking about it, this is the person you're calling and giving report to. Your hope as the sender is that they translate the exact information that you were intending them to. The problem is there are a number of things that can skew how they translate that information, which we're going to cover. So as we're discussing some of the things that can skew that translation, we'll hit this real fast. It's kind of a more humorous example of when sender and receivers do not line up. So if you have any military background, this will make perfect sense, but why services can't work together. And it's one reason services have trouble operating jointly is that they don't speak the same language. For example, if you tell Navy personnel to secure a building, they turn off the lights and lock the doors. Army personnel would occupy the building so no one could enter. Marines would assault the building, capture it, defend it with suppressive fire in close combat, and the Air Force, on the other hand, would take out a 3-year lease with an option to buy. With this, as you see, the sender is sending the same message to all 4 of these groups. Secure a building. But it's the same information, but it is how the receiver translates that information into what they're doing. So now we have the 3 parts of communication, but we also have these barriers that can impact the way the information is translated between the sender and the receiver. And these can be simple things just like distractions. There's a lot going on when someone's trying to tell you something, you might not catch it all. How they are emotionally. We all know when you're trying to communicate with someone who's in a highly emotional state, they might not get the same message you are trying to convey. If you're sending the message through something new, such as, oh, I sent it to you on a Zoom message, if you're unfamiliar with that technology, that might impact how you see that message. Any preconceived ideas you have, a big thing is inconsistency between the verbal and nonverbal cues. And we will talk more about those, but the biggest thing I want to bring up with that is, remember, right now, PPE always will impact your communication because it makes it more difficult to speak, to be heard. And finally, just having a distrust. If you don't trust the person who's sending you a message, that's going to be a barrier to how you receive it and what information you get from it. So there are 4 potential types of messages sent when you communicate. This really hits the point at why communication at times can be very difficult and how the message or information can be conveyed improperly. There's the message that we want to send. There's the message that you think you sent. There's the message you actually sent. And then there's the message that the receiver understood. Now, of all of these, the one that in its own way really matters is the message that the receiver understood. If you are telling someone a piece of information, hey, I need you to go get report, I need you to go check vitals, that's the one that matters. If they didn't understand what you were saying, they're going to go do the incorrect thing or something else. So, things that can impact for good or bad or further influence the message you're sending. The rate you're speaking, the volume you're speaking, the pitch you speak in, how you articulate, and body language. We mentioned that a moment ago, and we're going to go a lot more in depth about body language, especially when body language doesn't match the message. So, your speech rate, the speech at which you're talking. On average, 125 to 150 words for an adult is where we are. But this does vary by geographic location. If you go to different states, different regions, people speak faster or slower. When you're speaking, especially when you're communicating, speak at a rate that's easily understood. You don't want to lose people's interest or their ability to decode, but you don't want to speak so slow that they're kind of like, okay, get to the point. Volume. So you need to be heard, especially with working in a hospital. It can get noisy. So you need to make sure that you're using the proper volume, but you also don't want to be too loud. If people are asking you to speak up, you probably need to speak louder. If they're backing away or kind of like, whoa, tone it down, maybe you're speaking a little too loud. And you need to speak with confidence. You need to speak with the ability and the knowledge that you have and convey that in your tone. Pitch. This adds variety to your communications. It kind of punctuates things. We use a certain pitch when we ask a question versus when we make a statement. We don't want to have a monotone. Just for all of you listening, you would hate it if I just, this is pitch. This is how we will go through the entire you'll probably turn it off in 20 seconds, so would I. So you want to have the right pitch to go with what you're talking about. Sometimes things have a little bit more of an urgent pitch that, hey, this needs to get done right now, versus a, hey, take care of this sometime during the shift. Pitch will also change depending on gender, age, so it can vary quite a bit. Articulation. Clearly, if people can't understand what you're saying, you're not getting the right information across. So articulation and clarity is very important. And whether or not it's right or wrong, people are going to judge you. People are going to judge your education, your credentials, your knowledge and abilities based on how you speak. Now, this is especially impactful right now due to the fact that we're wearing so much PPE. Wearing a mask, wearing a face shield, being able to articulate becomes a bit harder, especially when the person you're also talking to has layers of PPE on. So be cognizant of that, and sometimes you need to focus a little bit more on how you're saying and being very clear. Body language. They say, 10% of what we communicate is actually the words we're saying. 90% is what our body language is. And we've all seen just, it's like someone telling you, oh, everything's okay, but you look at their body language and you're like, yeah, no, nothing's right now. This is where our feelings and emotions go. This also can be linked in with when somebody is telling you something like earlier, hey, everything's fine, but their body language doesn't match the message that they're saying. That's a barrier. This can also communicate things like threats, appreciation, a joke. So your body language is probably the more powerful than the words you're saying. So make sure those match and make sure you're using the right body language. So another important facet of your body language is that nonverbal communication. Those things you're not saying, but that are clearly communicating how you may feel about something or how you want to interact with a person. So there's 4 basic types. Proxemics being your perception and use of space. Kind of how close you stand next to somebody, how you interact in that sphere of, well, whether it's comfort or further away. Kinesthetics is the body movement. What are they doing while they're communicating? How is their posture, or how is your posture when you're sending a message? Are you standing very rigid? Are you more relaxed? Paralingual, this is things kind of like we talked about with speech and rate. How fast or slow are you talking? I think we've all seen somebody who something's going on and they start speaking much quicker, or they get nervous in a PowerPoint and they just rattle through 15 slides in 2.5 minutes. That's all paralingual. And then biometric. These are physiological changes that the sender cannot control. So think of this definitely in communication. If you're talking with a patient and you're asking about drug history, they're denying, but one look at their pupils and you're already thinking, hey, I don't think they're being honest with me here. This is something that, try as much as you want, you can't stop. Just like when you're nervous, someone may be nervous and they're going to be sweating, or their face may be red. There's nothing someone can do to stop a biometric response. It's just going to happen. So, one-way versus two-way communications. As you can guess, one way is pretty much you just giving direction to somebody. You're sending a message, you don't want any questions, any feedback, or any more interaction to go on there. So, very good for simple directions. Hey, call a code. It's super fast because there isn't that back and forth, but it's less accurate and you're not able to really convey a lot. But two-way communication is something that's better for problem solving. It's that back and forth. Hey, let's talk about this. Hey, can you come and look at my patient? Let's have a quick discussion. They don't look right and I can't figure out why. Two-way communication is much more involved, and it actually makes both parties that are involved in the communication more engaged. One-way, though, communication is you just need to send a message. It needs to be sent right now. So, defensive communication. And this is communication that can be aggressive, attacking, angry, or passive and withdrawing. Now, while it leads to many of these things, the biggest thing this is leading to in healthcare means that I'm not getting the right message across, which means we're not going to be productive in what we're doing. We're not going to solve whatever problem's going on, and we're not going to be able to take care of our patients. So when we're talking about defensive communication patterns, there are 2 main patterns. There's the subordinate defensive communication, which is that passive, submissive, withdrawing behavior. And there's the dominant defensive, which is somebody attacking you aggressively, attacking your behavior. Think of it kind of like a subordinate defensive would be someone almost at your level or maybe lower. You'd see a lot more of the dominant defensive of someone who is higher than you, such as a supervisor, an executive, a leader. So here's some examples of subordinate defensive tactics. When I read a lot of these, it kind of goes along the same trail of, as a subordinate, it's never their fault. It's never that person's fault that they didn't get something done. It's somebody else's fault. So things like, well, they haven't gone over it with me. Well, they didn't give me a report at the bedside or never told me. They never asked me for my input until just now. That's why I didn't give it. that you can't be serious. I have to take another admission. The kind of passing the buck. Well, I did my part and I called report. They must have lost it or they didn't do something right. You also have those dominant defensive tactics, which is kind of something you'd see from a higher level person. Things like, power play where they're, hey, you do this or else. Um, you know, a put down. Hey, if you were, a capable nurse would have already had this done. Hey, you must be slow at what you do, or you must not be a great nurse in your area because you haven't completed it. And when you're looking at these, I really want you to think as a provider of care, when someone communicates with you like this, how does that make you feel? Because that helps you reflect on making sure you're not communicating like this to somebody else. So, non-defensive communication is much better. It's assertive, it's direct, way more powerful. You're going to get a lot more things done. The old adage of you get more flies with honey than you do with vinegar. So this helps provide an order and a balance. You as the speaker, you're centered, you're assertive, you're in control, you're realistic, you're open, you're honest. You have that self-control. You're not just lashing out at somebody. And the listener, the receiver of that message, feels much more accepted than they do being dejected or rejected for their ideas and what they do. Non-defensive communication is the way to go. So there are some rules, and these 4 little rules help keep you in that non-defensive communication track. You want to define the situation. You want to clarify the person's position. You want to acknowledge their feelings, but bring the focus to facts. And we discussed that earlier. There's facts and opinions. Stick to facts. Opinions always change, and everyone has their own opinion. But if we're talking a fact of somebody's blood pressure, it doesn't matter if it's me or you or another nurse. 130 over 80 is 130 over 80 is 130 over 80. So stick to facts. So while we're discussing communication, we have to talk about the different generations. So there are 4 current generations that you can impact and interact with at the workplace. And every generation has its own little nuances, its own little communications, its own little kind of pluses and minuses. There's the baby boomer generation, which is about the 1946 to 1964 generation. The Gen Xers, 65 to 1980. Gen Y, or the millennials, which is 1980 to 1997. And then there's Gen Z, which is 98, and they haven't really capped that off. So Gen Z is going to be some of these new nurses and new staff members we start seeing coming in probably over the next year. So baby boomers, extremely hardworking, motivated by that position, perks, and prestige. These are the people who think about the corner office with the window, with the plaque on the table, with that title. They are very achievement focused. They're all about that work long hours because I want FaceTime at the office and people to see me because that's going to help that promotion. They don't mind confrontation. They're exceptionally loyal to what they do. A lot of baby boomers kind of find one area to work in and stick with that place. They don't move to different areas. They don't move to different cities. They grow roots in that community. They expect to be delayed in their retirement. The big thing with communication in baby boomers, they prefer face-to-face, person-to-person communication, actually having a dialogue with another person in front of them. So Gen X. I'm a Gen Xer. Latchkey kids, very independent and resourceful. Many Gen Xers lived that, hey, both parents are working. I have to get myself home. I need to make my own dinner, that kind of thing. Very entrepreneurial spirit. Gen Xers need a structure and a generation. Career oriented, but not as much as the baby boomers are. Gen Xers put more emphasis on that family time and that work balance life. They are tech savvy. Gen Xers grew up in that kind of boom of computers being used more and more, so they are familiar with the technology. Gen Xers prefer direct and immediate communication. They don't want to kind of beat around the bush. Just tell them what's going on, tell them what's needed, and let them deal with the issues. So Gen Y, that millennial generation, very comfortable with digital technology. Gen Y was growing up on that. Computers were much more available. People had computers in their homes. They are excellent at multitasking, but they are a little impatient. Remember, with Gen Y, this was a lot of that generation of instant gratification. So they don't think about things on that long term. They want to do something and then have that gratification. They would much rather communicate through email or a quick instant message. Let me text message you. Not so face to face. So Gen Y is very comfortable with things like this: webinars, online training, and technology. Very creative and achievement oriented. They don't get stuck in what Gen X and baby boomers sometimes do of that, well, an authority person told me to do that. Gen Y will ask, hey, why? They want a meaningful career. They want to grow as individuals. And they don't tend to stay in a job for very long. They are constantly looking to be happier and grow. And that's not a bad thing. So Gen Z, this is this newest generation that is coming in right now. And while we're looking at these, start thinking Generation Z was a group that it grew up with a phone, grew up with Google always being there and being able to order something on Amazon and have it delivered to your house by the next day. So how they view information is a much more rapid, well, it's always been at my fingertips. We all can laugh about it, but this is the group of people who can't imagine ever going to a library and using, books to find something. They've always just searched it on their phone, which means they are very technologically savvy. They're all about technology. They're very financially focused. Their job is to get them to that retirement point so they can go do what they want to enjoy. A lot of Generation Z is very entrepreneurial, meaning they want to build their own business because to them, that's linked back to that being financially focused. Hey, I'm going to get my business going. I'm going to be able to make money. I'm going to be able to retire. They enjoy conversing with other people, but not the same as a baby boomer will face to face. They enjoy the Skype, the Zoom. Hey, let's FaceTime real quick. They have a much different view on diversity growing up, where they don't see as many different social groups. They just see people. And of course, Generation Z is very competitive in what they do because they're entrepreneurial and financially focused. They want to be good at what they do so they can continue doing it and continue being successful. So now that we've covered the different generations and how to work with them and some of the little characteristics, let's just get to the main takeaways, big things. Open communication. What we strive for is open communication, a clear exchange of information with no fear or anxiety. Whether you're sending or receiving a message, we all want to know that what is heard and what is being said and what is being interpreted is the same thing, and that it's okay to ask questions or bring up concerns. Feedback loop. This is something when things get a little bit dicier on nursing units. Hey, I'm going to say something. You want to have that kind of feedback loop. Yep, I heard you. I'm going to go do this. We want to communicate where the speaker and the listener, so the sender and the receiver, there's that check. Hey, I'm letting you know you're going to take the next surgical admission. Yep, I got it. I got the next surgical admission. Awesome. That's what we want, is a good feedback loop. So when we combine open communication in that feedback loop, there's no confusion on either part of, you know what you need or what needs to be done, and you know how to take care of it, and there's no questions about it. This is what we are striving for. So, creating a climate for open communication. As I've been saying the message through the whole presentation here, communication is a significant part of your duties as a charge nurse. A charge nurse's job is to build that trusting relationship with not only the staff on the unit, but staff in other units and pretty much the entire facility. Trust is that foundation that you build that climate of open communications on. So it's very important. You need to determine as a charge nurse who needs what information and in what time frame. So you want to make sure that relevant information is provided to the correct person rapidly. It doesn't help anybody to find out information of, oh, well, you needed to do that 10 minutes ago and I'm telling you just now to do it. You got to communicate timely and proper information. Again, one of the real big ways to improve your good climate of communication on your unit is when you're talking with the staff, ask them, is there other information do you need? Do you understand every piece of information that I've provided you, which is kind of that feedback loop. Now, all the generations of employees want to know if something changes and how that change affects them. We want to know the why. Well, why is this happening? So use that when you're communicating. Hey, there was a change. You're not going to take the next surgical. You're going to take the gentleman who's coming from a different unit right now. This is changing because that person is more critical and they are delaying and holding that surgery in the PACU right now. The big thing that it's going to affect is the setup of the room. And here's what we need to do to fix that. So open communication is the goal. As we're talking about creating that open communication climate, here's some do's and don'ts about speaking effectively. Make sure you're speaking with confidence. Stay calm, especially when things get a little dicey. New nurses and senior nurses alike will kind of look to you as the charge nurse to judge how they should be reacting. If you're staying calm, they're going to stay calm. And just the same, if you're panicking, there's a good bet that a lot of other people in the unit are going to be panicking. Be generous with praise. Be courteous. Be friendly. Make a connection when you're talking to people. Talk to people, use their name, use their first name. If it's the first time you've worked with them or the first time you've ever communicated with them, clarify, introduce yourself. Make sure you paraphrase any questions you have asked to make everything very, very clear. And like we talked about earlier, vary that tone, pace, and volume as needed to keep people interested and keep people engaged in the communication. So we talked about the things to do to speak effectively. Here's some of the don'ts. One of the biggest ones here, which is why it's first, especially as you're covering and being the charge nurse on a unit, don't take things personally. People are going to say things, people are going to lash out, people are just going to have bad days. Don't take it personal. And while you're not taking it personal, don't lose your poise, don't get angry, don't swear, don't threaten them. Once you do that, you kind of lose that trust and that ability to be a good leader. So stay calm, listen to what they say, stick with the facts. Also, don't get too bound up onto something and being inflexible. Yes, there are times when they call and they'll say, hey, we need to take one of the aides off your unit for another unit. You can't get that lockdown defensive. You need to be a little bit flexible. And if you can flex, flex. If not, don't be angry about it, but clearly articulate, hey, we can't let that aide go right now. This is why. Along with speaking effectively, you also have to be able to listen effectively in communication. You want to make sure you not only hear what somebody is saying, but understand what they're saying. Actually reflect on what they're saying. One of the things that people notice when you're communicating, when they're talking with you and they ask a question or say a statement and you immediately have an answer, it creates that impression that you were really just waiting to talk. So take that moment, reflect on what they said, and then provide a good response. While you're listening, remember you're just listening. So you're not always there to advise or probe for different things, or don't get interpreting, well, I think this is how I would do it. And definitely don't judge people. Just as when patients are telling us things, you kind of have to have that, hey, don't judge their life because you think it is right or wrong. You're there to care for them. Listen effectively to what they're saying. And while you're listening effectively, one of the biggest things you can do is stop talking. You're listening. That's why it's on there twice. Be attentive. Think about things like your nonverbal communication, maybe your body language, because you want to put that speaker at ease. You're listening to understand what they're saying, whether it's a patient talking about their history, a family member talking about their loved one, another staff member talking about an issue with a patient, or another worker. You're listening to them to understand the whole picture. And with that, don't be angry. Stay patient. You're not here to argue with them. You're just here to listen. So putting it all together and wrapping it up. Effective communication is a powerful tool for a charge nurse. How you communicate and how you act sets the tone for your unit and your shift. If you're communicating that right at the start, well, tonight's going to be horrible, everyone's going to take it as a horrible night and probably just be a pain to deal with. If you communicate, hey, there's a lot going on, but we can make it through tonight, we got a good crew, it's going to go a lot better. The more you master these communication techniques and additional techniques to improve your communication, it's going to improve your overall effectiveness as a charge nurse. And a lot of things that we deal with, not only as charge nurses, but just as nurses in general, those barriers, those disagreements, those issues that pop up, a lot of them are caused by poor communication, and it can be quickly remedied or even prevented by using good communication. As we finish, I will leave you with this quote from Florence Nightingale. To be in charge is certainly not only to carry out the proper measures yourself, but to see that everyone else does so too. So remember that while you're acting as charge nurse. Here's my contact info if you have any questions, comments, concerns, or things you feel that should be added to this presentation for the future. Here's my email and my extension. Thank you and have a great rest of your day.